All in all, for me personally, it was quite an experience. Like I said, like this is not my first time teaching a program, um, but it was definitely interesting. It's the first time I've done it in this format,
Okay.
um, with the mixed with the mixed group. I mean, I'm used to teaching groups of between 10 and 45 ranges at a time. So this was very nice for us. Like we're gonna keep the group small. Between the two instructors, we can give a lot more personal attention to each student, trying to keep it like a 1-4, 1-5 ratio, um,
Yeah.
and that makes sure that everybody kind of gets enough reps on everything. And uh, like some of these duffels you can see here next to me, that's just like a third of of the kit. Well, I've got behind me as a storeroom. I've got a bunch more trunks in there um with stuff in it. So we make sure that everybody's got enough stuff. There's a couple of things that I think will add some new tourniquets that came in that will add, and
Yeah.
but I think for the most part, I was very happy and very impressed with the delegates that was there. Um, and I would love to kind of expand this, maybe take it on the road, because I know
Okay.
there's guys that can't get away from the uh, areas. Sorry, man.
Yeah.
From the operational area. So, and I think that's the next step for us.
Okay.
Pack it in the trailer and go to you guys for 5-6 days at a time.
Yeah.
'Cause that's what we are. One of our slogans and one of the t-shirts we're going to release pretty soon. Good medicine in wild places, man. That's what it's about for
I
us.
like that. Good
Um,
medicine, wild places. I like
yeah.
that.
Yeah, so there's a couple of t-shirts designs coming as well. So like you can see on the back of this one, like this is our sorry, our
Nice. I
logo.
see
And
it.
yeah, so each student in the student packs actually received a little uh anti-poaching medical first responder t-shirt with the logo on the back, cap.
Awesome.
Um they received reference cards, um that some guys didn't take them. Guess they don't need them.
Okay.
But so we included uh, the TCCC DD 1380, um,
Yeah.
just to kind of introduce them. It's
The
not
mist
really
report.
designed for our environment, but it's good
Yeah.
to expose them to a type of patient form. Um,
Yeah.
sorry, man, the O light or the ring light's reflecting. We had this vital signs reference card that they can use. It's all laminated. You can write on it with a Sharpie or permanent marker, rub it down with
And
alcohol.
clean it off.
We gave them an Atmist patient report card
Yeah.
to help with the handover. And these are all just samples of what they could use. Um,
Yes.
one of the things that we talked about, and it's my new favorite, it's the new favorite hotness, is from Euromedics. Um, it's a European-based um, education group,
Yeah.
very active in conflict zones at the moment and teaching, and I'll post a link of it. But this is their new casualty card. Um,
Okay.
so if you know the DD 1380, you'll be familiar
Yes.
with the basic layout, but this offers just so much more. What I
Okay.
love though is the vital signs trending
Okay.
at the back.
At the back.
So this is going to be our go-to card. This is open
Okay.
source. Um, Euromedics, if I'm not allowed to use this, just let me know. But I offload download it from your site, and this is what we recommend everybody use right now because I think this is
Yeah.
it's not just tactically, it's just not tactical.
Yeah.
It's that not non-battlefield related diseases and injuries, and um,
Okay.
so it covers pretty much everything. So this is the new hotness. Um,
Okay.
we'll post a link for their stuff as well. So
Yeah, please. Yeah, you can share that to me. I'm not
yeah,
too sure if you've seen. I'm not too sure if you've seen my March card and my missed report.
yeah.
I did
Some of
one.
the guys showed us. I like the small form factor. It's beautiful.
So I think, I mean, with me, I mean, it fits perfect into my IFAC.
Yeah,
And again, it's laminated, so
yeah,
can draw on it with a Sharpie. And also, I've kind of I've taken some of the elements out of it that would be for your more experienced responder,
yeah. I
because
the guy showed it to me and I love it. Like it's brilliant in its simplicity. It's exactly what that person needs on an
yeah,
IFAC. Um, it just doesn't have enough for your advanced responder, but for
correct,
how you guys are implementing it, I think it's brilliant. I like it.
awesome.
Yeah.
Actually, I appreciate that feedback.
Yeah, no, like they actually showed me some of the IFACs and things that you guys provided through donors, um, and as well as the card, and I think it's good. It's exactly what
Awesome.
that level of kit needs,
Yeah.
um, and it doesn't have a lot of noise, if I can call it that. Um,
Yes.
yeah,
Yeah.
so it's a good reference.
Okay, cool. So yeah, I think we should move on to the next topic, which I
Yeah,
think both you and I have been looking forward to.
yeah.
Um, and that's AI and teaching and learning.
Mm,
Um, so do you mind if I start off with
go for it.
two scenarios that I ran? I inputted into ChatGPT. You can still see me, right?
Yeah, yeah, yeah.
Okay, cool. Okay, so let me just go to my notes. Okay, so the first one, I'm going to go just with a simple one, which was the process of NPA or nasopharyngeal airway tube into a patient. Um, and this is obviously going to be a bit of reading, but it does go quite in depth. So I'm going to start reading if you're ready.
Go for it.
So the answer is sure. Placing a nasopharyngeal airway NPA tube is a straightforward procedure, but must be done correctly to ensure effective airway management. Here's a step-by-step guide. Indications for an NPA tube. An NPA is used when a patient has an obstructed airway but still has some level of consciousness, e.g., is responsive but unable to maintain their airway due to trauma, intoxication, or medical conditions like seizures. Contradictions. Suspect skull base fracture, e.g., facial trauma. Sorry, the camera's in the way. Um, cerebrospinal fluid leakage from nose or ears. Um, severe nasal trauma or deformity, known coagulopathy, risk of bleeding. Um, yeah, so that's where it finishes there, and now it starts with the step-by-step placement.
So at this stage,
So
it sounds very kind of verbatim what's in textbooks.
yeah,
The contraindications, I mean, that's been proven out to be more of a precaution. Um,
yeah.
where that contraindication comes from is someone placed an NG tube, a nasogastric tube, um, and like they had like 20 or 30 centimeters in the dude's skull by the time they realized that it was a problem. And from there on, anything that goes in the nose that become a precaution or contraindication. So
Was that an actual case?
yeah, it's very limited. Like I think there's like one or two. Um, and the basic skull fracture thing, I don't know if there's any cases where an NPA has actually caused it. I'll have to do some research.
Mm,
But it's just kind of now blanket. They don't want guys shoving this thing so far up. And obviously, if there's massive facial trauma and whatever, you can't get anything through it. You mustn't just force it in there. Um,
correct.
so yeah, I mean it's a bit more of a precaution, but that's kind of where that contraindication come from. So far it's pretty spot on.
Yeah. So then it goes into the step by step. So number one, assess the patient. Check for contraindications. Ensure the patient has some level of spontaneous breathing. Two, choose the correct size. Measure from the tip of the nose to the earlobe or the angle of the jaw. The diameter should be slightly smaller than the patient's nostril. Number three, prepare the equipment. Use a water-based lubricant, never an oil-based one. Have suction ready in case of secretions. Number four, insert the NPA. Position the patient. If possible, keep the head in a neutral position. If spinal injury is suspected, maintain manual stabilization. Number two, lubricate the tube. Apply a generous amount of water-based lubricant to the NPA. Number three, insert the nostril, typically to the right nostril, as it is often larger. Hold the NPA at the flange end. Insert with a bevel facing the septum, flat edge against the septum. Advance it gently along the floor of the nasal passage, not upward. If resistance is met, try another nostril. Four, advance until the flange rests against the nostril. If the patient coughs or gags, it may be too long, and then reassess the size. Number five, confirm placement. Observe chest rise and fall to ensure the airway is open. Check for air movement at the end of the tube. Look for signs of discomfort, which might indicate incorrect sizing or placement. Number six, secure the NPA. If needed, use tape or strap to keep it in place. Reassess frequently for blockages or displacement.
So
And that's
with
the end.
AI in general, when it comes to procedural things, it will just draw off whatever is open source.
Yeah,
So procedural stuff like step-by-step stuff, that's usually like spot on because it just
yeah,
pulls it out of whatever's published. Where
yeah,
you have to kind of be wary sometimes, it's just the how up to date the info is that they're pulling out. Like it is learning
yeah,
like AI and ChatGPT is much more accurate now than what it used to be. Um,
yes.
I do remember a conversation or a podcast I listened to with the use of AI and ChatGPT um, during university and medical studies, where a lot of the guys were using that to diagnose and develop treatment plans, um, and it was just not accurate enough at the time.
Okay.
Um, So on procedural stuff, that's pretty good. Diagnostically, it kind of still for me personally, it still falls under the WebMD category where like you kind of actually have a cough, but by the time you're done, you're dying of right pinky toe cancer or something. Um, like it for me, it's still there. Like I'm a bit slow on accepting AI in general. Like my wife
Yeah,
converted me to using certain tools, like
yeah,
when it comes to administrative stuff, um, and like summarizing. But even with summarizing, like um, when we were prepping for this course and I was developing the lesson plans for this, um, I would convert uh, the whole manual into chapters and convert it to PDF and let ChatGPT summarize it for me. But you'd see that it'll summarize it to such an extent where um, you'd lose a lot of relevance and context. Where I'd have to go and like, okay, like, listen, we actually need to add some meat to
yeah,
this. Otherwise,
yeah,
these bullet points are not going to mean a thing. Um, so that's what you have to be super careful of when using tools like this.
yeah. Did you find that it added any information that wasn't needed that it had found online,
Yeah,
and
so
added it to your curriculum?
so when we did the summarizing stuff, and this is a like we didn't use it to develop any of the curriculum or stuff. It's like when I did the summarizing,
Yeah.
um, what it's very good at is cross-referencing. Um,
Okay.
and you have to be super, super specific on what you wanted to have a look at. Um,
Correct.
to give you an example, uh, the which I'd summarize a chapter. Let's say, for example, airway emergencies, airway management.
Yeah.
It'll summarize it. I'll go through. I'll say, okay, listen, like I have to add some stuff here. I populate wherever I think it's needed, and then it's okay, but
Yes.
cross-reference this with the latest Committee of TCCC combat lifesaver airway protocols, um, and cross-reference with the TECC recommendations. um,
Yeah.
and it'll kick out the kind of what you need to look at. Um,
Yeah.
but you can't just take it verbatim because it'll then
Yes.
start adding surgical airways and it'll go into to depth. Um,
Yeah.
so it can take you down a bit of a rabbit hole.
Yeah.
It
Well,
is a
that's what
good
I
tool
picked
to
up as
save
well.
time, but it can't just replace due diligence. Um,
Yeah.
yeah, so I'd be super careful for using that um, as a tool to just plainly educate if you don't have any
Yeah.
background. Um,
Yeah.
but it is a useful tool. Like
Yes.
it kind of
Well, so
stings
that that
admitting it,
that
but
that
it is it is a useful tool.
well, yeah. So that's kind of why I've been wanting to talk about this with you, especially with you being an instructor. Um, it does kind of make me worried about not just in the medical field. I mean, we could relate this to firearms training. We could relate this to just basic civilian work. Someone who's struggling with being a manager. They could
Yeah,
go into ChatGPT. How do I become a manager better at my job? And this is what my job is.
yeah,
I'm just thumb sucking what someone would want to
yeah, yeah, yeah.
input into ChatGPT. Where it kind of starts to I don't know, just make the person not dumber, but take away the wanting to learn more and learn the proper way and kind of cheat and go around all the hard work and
Like
just get ChatGPT provide the answers for them.
on an educational level, like I said, I've been very resistant to it. Um, like my wife is very educated and clued up on education. She's got a postgrad in, or one of her postgrad is in education, and um, she actually kind of pushed me. I wouldn't say gently, but she generously encouraged me into this direction to use this tool. Um,
Yeah,
because it definitely is there. But if you don't know what you're looking for, it can get away with you. Um,
yeah,
the like I said, just specifics is super, super important. Like you have
yeah,
to know where to start looking.
yeah,
Um, I wouldn't go and just type in a bunch of like this is my symptoms. What is it? Um,
yeah,
like I'm not there yet, and I don't think ChatGPT is there yet. And I know there's
yeah,
certain safeguards that what it can and can't teach you. I'm not
yeah,
an AI expert by any means, and like I said, I've been pretty hesitant to kind of delve into it. I've seen the movie, and I'm not quite keen on how it
yeah,
ended. But on the flip side, organizations like and I'm speaking under corrections, it's either uh, Ragged Edge Solutions out in the US or the guys that developed the MyMedic app,
yeah,
which is a PFC slash TCCC. It's like a digital patient reporting app. I'm a big
yeah.
fan of it, by the way. Like I'm super super happy with it. Um,
Okay.
the where they're now using VR and AI to assist clinicians to um, diagnose and treat in austere and remote environments. Like I know it's still very experimental, and I only seen a couple of posts on it, and I'm not an expert on it by any means. But like I said, like I know this is now a thing. It is starting to become more and more ingrained in the medical field day to day. Um,
Yeah,
so I mean it's like many fields now where um, these AIs can learn at a rate that we can't even get remotely close to. They can process data much faster than we can. Um, so yeah, I mean there's a place for it, but I'd be super super careful. Don't just blindly trust in it yet. Um,
yes,
I'm not too sure if it's at that point. And again, this is just This is just a dumb medic in Africa kind of voicing his opinion, but it is a tool. It's a useful tool, um, but learn how to use it properly before just blindly
Yeah.
taking it for what it is.
So that brings me up onto the scenario that I actually put an input into ChatGPT. So let me actually just go, instead of going through to my notes where I saved it, let me see if I can just, if ChatGPT, so, okay, cool. So I gave it a scenario. I'll go through the scenario with you quickly. Two rangers are in the field. Both have been charged by an elephant bull in must. Ranger one gets hit, has a piercing leg wound, and has either signs of a main artery hit. Has piercing leg wound, signs of his main artery being hit. He also has eviscerations to the stomach and a TBI. All right. Ranger 2 has shot and killed the elephant. What is Ranger 2's next actions from having killed the elephant all the way to when medevac arrives? So that's the scenario that I created. So it actually mentions the Committee on Tactical Combat Casualty Care. So its answer to me is, let's break this down step by step using the Committee on Tactical Combat Casualty Care guidelines while considering the unique challenges of a remote anti-poaching operation. So that was its response to me. I never mentioned anything about anti-poaching. I just mentioned two rangers in that specific scenario. So for me, that's quite interesting that it went straight to TCCC and also mentioning the unique challenges that rangers face.
Yeah,
So I think that's pretty awesome.
yeah, it's a good start.
So yeah, I'm going to go straight into its response. Immediate actions from Ranger 2, post-engagement and scene safety. Number 1, confirm the threat is neutralized. So ensure that the elephant is down and no longer a threat. Be alert for other elephants in the area. Move to cover if needed, either behind a tree or termite mound. The fact that it mentioned termite mound, I was
That's
very
pretty
impressed
good.
with. Number 2, communicate the emergency. Radio base or ops center with a 9-line, a medevac request, if applicable, or other emergency extraction protocol. If communications are down, prepare for self-evac or relay a message via another team. Then provide GPS coordinates, a number of casualties, and a brief assessment of the injuries. Now it goes to casualty care. Ranger 1, following March protocol. So number 1, massive hemorrhage, arterial leg wound. If a major artery, e.g. femoral, is hit, apply a high and tight tourniquet immediately. So I like this one immediately because it says use a cat tourniquet. So I'm already a huge fan of that. Not a softie, a cat. Anyways, that's personal. That's me personally. It says use a cat tourniquet or improvised tourniquet if no commercial option is available. If bleeding doesn't stop, apply a second tourniquet above the first. Mark the time of the tourniquet application. Okay, now we move on to airway, eviscerations, and possible TBI. So I would just want to state this now because ChatGPT is going to mention this later. They don't mention take away the firearm of the ranger. That for me, especially if the ranger has a TBI, I feel it's one of the first things that you do is remove their firearm from them.
Yeah.
I'm not too sure what your thoughts on that,
Yeah,
but
I mean, It depends on level of consciousness and kind of what his situational awareness is. But in a situation like this, for the most part, uh, yeah, I mean, you're not in active gunfight, and just remove any possible accident that might happen.
Yeah.
The current thought is that like um should on the AFBOO score, once you move below alert, you remove weapons and radios. Um,
Yeah.
just you don't want issues. Um, but yeah, if the TBI is in such a point where like the dude's a bit confused or is like losing consciousness, obviously weapons and radios gets taken away.
Yeah.
Yeah.
Okay, so yeah, number two, airway, eviscerations, and possible TBI. If conscious, encourage the casualty to keep still and do not allow them to remove or touch their evisceration. If unconscious, perform a jaw thrust maneuver to maintain an open airway.
Jaw
Check for
thrust
airway
instead of the head tilt
obstruction.
chin lift due to the possible neck injury. That's pretty good.
Yeah. If unconscious, perform a jaw thrust maneuver to maintain an open airway. Check for airway obstructions, vomit, blood, etc., and clear if necessary. NPA, nasopharyngeal airway, can be inserted if airway compromise is suspected. And then we move on to respiration, TBI consideration, and potential internal injuries. Check breathing rate and depth. Watch
Yeah.
for signs of tension pneumothorax if ribs were impacted.
Yeah.
Keep casualties' head elevated to reduce intracranial pressure, and administer oxygen if available. Yeah. And then go straight onto circulation and shock prevention. Reassess tourniquet for effectiveness. Control secondary bleeding from other wounds using hemostatic gauze or pressure dressings. Elevate uninjured limbs if no spinal injury is suspected. Do not give fluids if TBI is severe, for
Yeah,
intracranial pressure
you
risk.
you see now this is now where we get to the point where it's now moving a bit out of that scope. Um, because is it oral fluids? Because that's technically okay, depending on
Yeah,
the level of consciousness and so on. Um, but it's definitely a consideration when giving IV fluids because you don't want to
yeah.
raise blood pressure, and which oral fluids won't do, but IV fluids will. Um,
Well, yeah,
yeah. So, but up until that point, they've been pretty spot on.
pretty good. Yeah.
Yeah.
Okay, so now we move on to H, hypothermia or head injury management. Prevent hypothermia even in hot environments, which I appreciate this.
Yeah.
Cover the casualty with a thermal blanket. So I think that's a little bit too simple. It's just, it should go into the way it has done everything else.
Mm.
It should go a little bit into too more in depth of how to use the thermal blanket, because you can use the thermal blanket incorrectly. You
Mm.
know,
Yeah, I mean
where
it's 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 appropriate to I feel it's appropriate to the level of the guy asking the question, like if it's
yeah,
on a basic level.
yeah,
But yeah, I mean it's not horrible to go into a bit more detail on hypothermia management. Yeah.
yeah. And then it says avoid placing pressure on the evisceration wound, cover with moist and sterile dressing and plastic wrap to prevent infection. Or, yeah, I mean, it could also mention there using the thermal blanket.
Yeah.
And then preparation for medevac. Now it goes into more. It covers the weapons. So preparation for medevac. Number one, secure gear and weapons. Make sure Ranger One's firearm is safe and secured. Ensure personal gear is prepared for quick evac. Number two, extraction site preparation. Move to a landing zone, LZ, or safe pickup point if the casualty can be safely moved. Clear debris for helicopter or vehicle approach. Use signal methods, either smoke, IR strobe, mirrors, to guide medevac if needed. Number three, continuous monitoring. Keep checking the casualty airway, breathing and bleeding. If they worsen, adjust interventions accordingly, e.g., second tourniquet or airway repositioning. Record all treatments for the incoming medics. Final thoughts. Evacuation priority. Ranger 1 has life-threatening injuries, making rapid extraction the top priority. Ranger 2's role. He must stay focused. No unnecessary risks trying to move the casualty unless absolutely required. Time is critical. If medical extraction is delayed, Ranger 2 should prepare for prolonged field care, maintaining airway prevention, further blood loss, and minimizing shock. And then it just gives me a question, would you like to go into further detail about any of the steps?
Yeah, I mean, for what the question was, I like I said, detail and specificity in the question is critical because then you
Yeah,
can have a more detailed answer like what you got. Um,
yes,
because it gives the engine or the AI a chance to kind of develop and kind of reference materials, and most of that is either out of the TCCC manual, like the
yeah,
March stuff. It's pretty
yeah,
much um, what you would expect from that, with cross references to um, probably like some wilderness first aid books and um,
yeah,
wildlife knowledge. So like there's a lot of detail there that was I found pretty cool. Um,
yeah,
but still, I mean, you still need to learn how to apply a tourniquet. You still need to get that
yes,
hands-on skill. Like
yeah,
they say, this is what you have to do, but you still need to learn how um,
yes,
to
correct.
do
You
that. So
still need the practical experience,
yeah,
of training TQ every day, and especially in those scenarios. Because I mean, so a lot of the training that I do with my guys with the TQ, I mean, they're so used to just applying a TQ.
mm,
Whereas, when I do it, I'm like, okay, cool. When you're applying the TQ, I want you to be concentrating on what's happening around you.
yeah.
Because
Don't get
if
that
you're the
tunnel
one,
vision.
exactly, because if you're the one who's shot, okay, it's pointless having your colleague trying to apply the tourniquet on you while you guys are still being shot at.
Yeah,
Okay, he's going to be taking care of the threat. If you've been shot in the leg or if you've been shot in the arm, you can apply the tourniquet to yourself.
yeah,
Don't wait for help. You are your own help.
yeah.
But while you're applying the tourniquet, you need to be concentrating on what's happening around you. Because if you're not concentrating on around you, you're dealing with more threats. You're not just dealing with the fact that you're being shot at. There
Yeah,
could be a dangerous animal in the area.
yeah. I mean, it just gets back to that point where the AI won't replace. I mean, you're still the guy there, so that engine is not going to replace the relevant training because it says make sure that it's no longer a threat. What is the steps that you need to do to make sure that that thing is no longer that thing's not going to it's not going to shoot the elephant for you. Um,
No.
you know what I'm saying? So
Yeah.
um, you still need
I
to
mean, maybe in 20 years' time.
yeah. Well, maybe not even that long, probably, but um, it still needs to you the guy on the ground still needs to have these skills.
Yeah.
And I'm like I showed you, man, like I'm a big fan of reference. And it is a reference. Like I'm not proud to admit it, but I've consulted Dr. Google once or twice. But I know where to start looking, and I know where to kind of stop digging.
Yeah. You know what
Um,
questions to ask, yeah,
Say again?
you know what questions to ask.
Yeah, like I said, like you kind of pretty specific. You know what you're looking for. So you need to have that knowledge and skill to kind of know, okay, this is where I need to start asking questions, but I also need to know when to stop going down a rabbit hole.
Yes.
Um,
Yeah.
for example, now with the fluids, like for the most part, like they always teach like don't take oral fluids regardless of what. Now, obviously for this guy with the evisceration, like okay, fluids will be out. But if he didn't have fluids, then or didn't have an evisceration and it's just the extremities, why can't he have a drink? The dude's gonna be he's probably bleeding out. He's going to need fluids. He's going to be thirsty, and he's going
Yeah,
to have a prolonged evacuation time. Have him drink fluid.
correct.
It's not going to raise his intracranial pressure. It's not going to raise the pressure in the TBI or the head
Yeah,
injury. Um, but what is going to do that is IV fluids. But that's above the
yeah,
scope of the question. So
yeah,
can I know where that is? And so
yeah.
yeah.
So I think another thing that
We've got about a minute on this session though. Just heads up.
okay, okay.
Yeah.
So then just to add to that, I think the big thing, maybe even just to finish off, I think a big thing to add is hope.
Yeah.
The fight for life. I think
Yeah.
that's very important.
Yeah. No,
Yeah,
absolutely, man. I mean, it's not going to change it. It's still need the flesh and bone and the guy on the ground, the man in the arena, like Roosevelt said.
yes, yeah, exactly.
Yeah. The what we were last chatting about AI and ChatGPT and so on.
Yeah,
Just on the technology stuff, just before we start wrapping things up. For the record, I think it is a useful tool. But all
yeah,
tools, like I said, like with all tools, you kind of need to know when and where to apply them. It
yeah,
can't just be a substitute for training and education. Um,
yeah.
and for the places where we find ourselves most of the time, you're not going to have the signal strength to run an AI to try and save you. So
No, correct.
just keep that in mind. But I am pretty
Yeah,
impressed with the detail that scenario generated that you brought up there.
yes. And then I think just from my side, I would say to anyone because there's been talk about how kids have been using AI to help them with their exams and with their
Yeah.
orals and things like that. Um, when it comes to especially medical, please do not rely on something like AI to help you learn. Rather go the more conventional methods and actually do a course. Don't rely on creating scenarios on ChatGPT to use that as course material, because you're taking away from people like yourself who have practical hands-on knowledge and experience, um, who are able to teach the do's and don'ts. You're not going to be learning much.
Yeah. Like I mean, I'm definitely very careful of not to be the guy of back in my day type thing. I detest that. Um, but I have to say though, I am nervous of being a patient in 10 years when today's graduates or today's med students graduate. Um, like there's definitely uh, massive movement towards controlling the use of AI in our universities and educational institutions. Um, so it's going to be interesting, man. Like it is like
Yeah,
to see where it's going, the technology globally, how it's going. Like I've shared a few videos now in the last couple of weeks of drones being used for patient evacuations off the battlefield. Like there's a video doing the rounds now of a DJI Agris, the big commercial agricultural drone, with a
yeah,
dude in a hammock being flown off the battlefield. Uh,
really.
so yeah, I mean it's where it's going. I mean that thing's got a load capacity of 120 kilos. Like they'll
That's
have to strip
incredible.
me naked to load me on it, but like, and then I'll probably drag my ass across the soil. But that's where it's going. I mean, there's a video I shared as well where there's these dedicated medevac drones now where you can put someone
Yeah,
inside. Um, so I mean, you either going to move with the times, or you're going to be left behind. Um,
yeah,
VR, AI, it's definitely where it's going with training
yeah,
and education. Um, and there's been companies that's using AI or not AI, sorry, VR training modules for
Yeah,
patient scenarios and so on. And I think it's awesome. Like we looked into it,
yeah,
but we didn't have $25,000 to spend on the licenses and the
yeah,
equipment. But it is definitely that's where it's going. Um,
yeah,
and yes, we need to move with it. But it's like you said, know when and how, but also um, have the knowledge, because that's one of the big things we teach as well. You might not have this available in the environment that we work in,
yes,
to reference or to access that. So um,
yeah,
are you going to just be another guy that without your phone you're useless? So put in
yes,
some of the old
yes,
school work as
exactly,
well. Yeah, and I mean, I'm
exactly.
not I'm not the world's best student. Like, I have to put it out there, um, but I do put in the effort when it's needed.
When it's due, yeah, no, 100%.
Yeah.
Okay,
Mm.
cool, man. I can't believe that again, what was just going to be a quick discussion has turned out to be what's what over 2 hours again.
Yeah, it's probably going to be like a six-part. Thanks to Zoom, it's going to be like a six-part episode. So there's going to
But
be
yeah,
a lot of awkward cut-offs, but it is what it is, man.
yeah, it is what
Um,
it is.
but yeah,
But again, as always, it's been good though. It's been good to talk. It's also
yeah.
been good to catch up and also get some perspective from your side as to how the course was.
Mm.
Um, if I could just mention, obviously with Granger Guardians, I'd just like to thank you with how you've helped us with the course. Um, from a financial point of view, I'd like to just say thanks. Um, but I'd also like to, if I could just put it out there that we continue to look for funding, not just for courses, but for uniforms, for boots, for anything else. Um, and if anyone who's listening, if you're able to help out, please reach out. They can even reach out to you if they know you. Um, yeah, please reach out. Let us know how you would be able to help out, and we can take it from there.
Yeah. Like I said, the discussions were had with some of the guys that want to help. The
Yeah,
um, I think for us in that spike that we saw in 2011, 2012, everybody was willing to help, and it kind of fizzled out. And
yeah,
but the fight is still real. I think the last numbers for the last 6 months was 450. Um,
mhm,
you could please correct me. I don't know if that was for the entire year or for the last 6 months.
yeah,
But 450 rhinos down that we know about in South Africa. And this isn't just a South Africa problem, but we definitely. I mean, that's kind of why we threw our hat in the ring with you guys. Like, we know that it's going to the right place.
yeah.
Um, so
I
we
appreciate that.
we will definitely put it out on our platforms as well. And um, if there's anybody that's wanting to donate or to assist with either financial or equipment wise, um, please feel free to reach out to us, and we'll make sure that it gets to
Yeah,
gets to the right guys. Yeah,
yeah.
to you
And then
guys.
the same from my side, just in terms of, sorry, my battery's quite low.
No worries,
Just the
man.
same from my side in terms of, towards Meerkat Solutions, and obviously, anyone that I hear that's wanting to do some advanced medical training, I'll obviously send them your way.
Oh, thanks, man.
And yeah, to anyone that's listening, the three rangers that's Ranger Guardian sent um, have nothing but great reviews. So yeah,
Thank you.
yeah,
No, thanks, man. That's much appreciated, and hopefully we can take it on the road. Um,
yeah,
maybe go visit you guys up there for a bit.
Yeah.
I mean,
No,
it's one of
I'll
the
see what
few
I can.
very, very wild places that's still out there is where you guys are. So,
Yeah.
and I haven't been up there in I would say 7, 8 years. So, um, like that's proper bush. That's nice.
Yeah. No, it is. It is. I'll see what I can do. I'll speak to the powers that be.